5, 4.
Hi, my name's Mayel Comey and I'm Deputy Director for Rapid Testing Policy at the Department for Education. Welcome to the COVID-19 National Testing webinar series, where today we will be covering rapid asymptomatic testing in private, voluntary and independent nurseries. For ease, I will refer to them as nurseries throughout this webinar. My colleague Peter Marks and I will present for about half an hour before answering a few frequently asked questions. If you have any questions which are not answered over the course of this webinar or via the guidance on the document sharing platform, please do get in touch with the department via the DFE helpline or your usual contact routes. If your question isn't addressed today, we will try to ensure that it's covered in the next iteration of the published FAQs. Further documentation on asymptomatic home testing has already been made available on the document sharing platform, which you should have received a link to. If you haven't, please contact the DFE helpline. As this webinar is on YouTube, please do share this information with colleagues. Please note this webinar will not cover how staff should use the tests at home, but rather the process of how the testing programme should be managed by settings. Staff from within your settings should be encouraged to view previously recorded webinars for in-depth information and videos on how to do self-test at home. These are all available on our document sharing platform. Who is being tested and why? So we are offering rapid asymptomatic testing for all nursery staff. We recognise that some early years staff have felt vulnerable and that the sector has worked incredibly hard to remain fully open so that young children can be educated and families can be supported. From the 11th of March, nurseries should have started to receive sufficient test kits so that staff can begin home testing from the week commencing the 22nd of March. Regular asymptomatic testing will help to break the chains of transmission of coronavirus in education settings by identifying asymptomatic positive cases. This is important as up to 1 in 3 people who have the virus have it without displaying any symptoms, so could be spreading the disease unknowingly. Staff who test positive will then self-isolate, thus helping to reduce transmission of the virus. Please note that you shouldn't offer testing to children in early years settings. Public Health England have advised there are currently limited public health benefits attached to testing primary aged or younger aged pupils with lateral flow devices. The process of testing at home is simple and quick. Tests known as lateral flow devices or LFD tests enable the rapid testing of staff from their home without the need for a laboratory. Nurseries will be provided with these test kits to distribute to their staff so that they can conduct testing at home. These tests are provided free of charge. All nursery staff will be offered LFD test kits for routine testing at home twice a week, 3 to 4 days apart. Testing should ideally be done before they come into the workplace in the morning. However, if this isn't convenient, staff can test on the evening prior to their working day. Those who test positive will then need to self-isolate in line with the government's stay-at-home guidance and take a confirmatory PCR test. LFD technology has been validated by Public Health England and the University of Oxford. It's approved for home use for case finding by the Medicines and Healthcare Products Regulatory Agency, the MHRA. The test produces rapid results in around 30 minutes. It doesn't require professional training or complicated lab equipment. It remains imperative that the Public Health England endorsed system of controls continues to be rigorously applied alongside regular asymptomatic testing. Next slide, please. Thank you. This slide shows some of the key questions about the programme, and we will cover some of these in more detail throughout this webinar. Testing isn't mandatory for staff, and staff do not need to provide proof of a negative test result to attend their workplace. However, participation in testing is strongly encouraged. This programme does not replace the current testing policy for those with symptoms. Anyone with symptoms, even if they've had a negative recent LFD test result, should still self-isolate immediately according to the government guidelines and book a PCR test. Adults and young people that fall into the clinically extremely vulnerable group should continue to follow the latest guidance on shielding and protecting extremely vulnerable persons. This slide provides an overview of who has responsibility for what in delivering the testing. As you can see, the administrative requirements for nurseries are relatively light, as tests will be conducted at home by staff. So DHSC and NHS Test and Trace will provide nurseries with the Clinical Standard Operating Procedure, or the SOP, and instructional videos, both of which are available on the document sharing platform. NHS Test and Trace Result Reporting System, further information for which is also available on the document sharing platform, and home test kits. DFE will provide overall policy and operational delivery oversight. You have access to our helpline, so you can contact us if you have any issues. Nurseries will need to provide appropriate oversight and governance. They will need to manage their communications with staff and stakeholders, manage their test stock and reordering, set up a test kit log, incident reporting, and ensure alignment with their local public health response to COVID-19. We will go into more detail on these aspects during the webinar. Resources and guidance have been provided to support you in setting up testing for your staff, and we've provided guidance around administering testing too. This includes the how-to guide and a series of YouTube videos that provide a step-by-step guide to COVID-19 self-testing. These have all been shared on the document sharing platform, and as I said earlier, please do get in touch via the DFE helpline if you haven't received a link for this. I'm now going to hand over to my colleague, Peter Marks.
Thank you, May. Hello, everyone. I'm Peter Marks. I'm a public health doctor who's currently working in NHS Test and Trace. And we're now going to talk about receiving your test kits. No specific steps need to be taken to sign up to receive the first delivery of test kits. DHSC will set out a legal agreement with terms and conditions that nurseries will agree to by participating. This document will be on the document sharing platform. Initial deliveries to the nursery started on the 11th of March. You can find out when to expect your first delivery by checking the delivery schedule, which will be published on the document sharing platform. The deliveries nurseries receive should contain sufficient test kits for all your staff for 3 to 4 weeks. Guidance on how to reorder further testing supplies will be made available on the document sharing platform by early April. Next slide, please. The collection point does not need any extra infrastructure. However, it must be able to be secured to prevent unauthorised access to the test kits, such as in the staff room. It must not be outside. The test kits need to be stored in temperatures between 2 and 30 degrees Celsius. It must have a desk or space for individuals to sign for the test kits they are collecting, and it must have enough space to allow for social distancing. The collection point does not need to be at a fixed point within your nursery. Next slide, please. Running your collection point. The administrative requirements for education settings are relatively light, as tests will be conducted at home. The 2 roles that each nursery will require are a COVID coordinator and a registration assistant. The COVID coordinator or programme management responsibilities cover the overall management of COVID self-testing programme at the nursery, including engagement and communication with staff, ensuring staff are using the right instructions and that they sign for the test kits using the test kit log, reporting incidents and carrying out risk management, storing and reporting any required data, and reordering tests when required, and advice on how to do this will follow. The registration assistant duties cover distributing the correct number of test kits and managing the distribution schedule, working with the COVID coordinator / programme manager to manage the stock of kits, recording self-reported results for weekly testing on their COVID-19 test register, sending reminders to staff to report their results online and to the nursery, and responding to staff questions about testing. These two roles could be done by the same person. This slide provides an overview of what you need to tell your staff. There are a number of resources they can view to support them in testing at home. These resources are available on the document sharing platform. Next slide, please. Participation and data protection. All participation in testing is voluntary. Nurseries will need to satisfy themselves that they have a lawful basis for processing personal data. Nurseries will provide staff with a privacy notice, which is provided as a template on the document sharing platform, which explains what personal data is required to participate in the programme. Next slide, please. Signing for the test kits. When issuing the kits to staff, the issuer must record who takes the test kits. A template test kit log is provided on the document sharing platform. This includes the name of the nursery, the name of the person issuing the test, the date of issue, and the lot number of the test kit. The new IFU has been received and the name of the person using the test. This log should be kept until further notice. Please ensure that you get a signature from the member of staff being issued with the test kits. Next slide, please. We're now going to talk about the instructions for use. For nurseries, instructions are supplied inside the test kit, so there is no need to hand out instructions for use separately. You should refer to version 1.3.1, which is contained inside the supplied test kits. For private, voluntary and independent nurseries, instructions are supplied inside the test kit, so there is no need to hand out instructions for use separately. For primary schools, school-based nurseries and maintained nursery schools, please continue to hand out instructions for use version 1.3.2 or version 1.3.3, which have been supplied separately from the testing kits. Next slide, please. Reporting results online. If you get a positive result, it means you are probably infected with coronavirus and you risk infecting others. When you report your result, you will be provided with further information on the next steps to take. You must self-isolate immediately in line with government guidance and book a PCR test. Please note, your results will be identified as an LFD, that's a lateral flow device, result on the text message you'll receive from NHS Test and Trace. You, anyone who lives with you, and anyone in your support bubble must self-isolate in accordance with current national and local guidance. If you get a negative result, it is likely that you were not infectious at the time the test was taken. A negative result, however, is not a guarantee that you do not have coronavirus. If you test negative, you must continue to follow national and local rules and guidelines, including regular hand washing, social distancing, and wearing face coverings where required. If you develop symptoms of a high temperature, a new continuous cough, or a loss or change to your sense of taste or smell, you and your household must self-isolate and get a PCR test. If you get a void result, this means that the test has not run correctly. You need to take another test. Use a new test kit, but do not reuse anything from the first kit. Even if the test is negative or void, the results need to be reported digitally to NHS Test and Trace. It's important to report negative tests so that we know the numbers of people tested and can effectively monitor the levels of COVID. Void results also need to be reported for quality assurance purposes so that we can monitor that the devices are working correctly. There are two ways you can report your result. You can either report online by visiting www.nhs.uk gov.uk/report-covid-19-result. Alternatively, you can report via telephone. The lines are open every day, 7 AM to 11 PM. In England, Wales and Northern Ireland, phone 119. In Scotland, the number is 0300 303 2713. You will need the QR code or the ID number under it on the test strip to report your result. Next slide, please. After taking a test, subjects must report their results digitally to NHS Test and Trace and also inform their nursery. Staff should contact their nursery to inform them of their latest test result. This is necessary because nurseries are not able to view the results that staff have reported online. The nursery should record these results in a register and keep the details until further notice. Therefore, the nursery should maintain their own locally managed and separate results register. It's up to the nursery to manage this, however, a template spreadsheet is provided. Nurseries could also use this register to manage and schedule test kit distribution. The register should be kept until further notice. It must be a separate document to the test kit log. This is for data protection reasons. Next slide, please. Incident reporting. There are two categories of incidents that nurseries need to be aware of: clinical incidents and non-clinical incidents. If there's a clinical incident which has led or has the potential for harm, for example, if a swab breaks in the mouth or there's bleeding or an allergic reaction on using the kit, participants are advised to report it as a yellow card on the website listed here. That's www.coronavirusyellowcard.mhra.gov.uk. For non-clinical issues that occur at home, such as something damaged or missing or difficult to use in the kit, or you're unable to log a result, then it can be reported to 119 in England, Wales and Northern Ireland, and on 0300 303 2713 in Scotland. And back to you, May.
Thanks very much, Peter. So, to recap on resources, you can find the latest guidance on the document sharing platform. The following resources have been created to support you in setting up testing and to provide guidance around self-administered testing. We have the how-to guide, instructions for use handbook, and a YouTube video series covering a step-by-step guide to COVID-19 self-testing. Please also keep an eye out on your Ofsted registered email account, as this will be our primary route for communications to keep you up to date with the latest information and announcements. For any questions, concerns or issues, please call the DFE Coronavirus Helpline. The numbers are on the slide. Anyone displaying one or more of the following symptoms of coronavirus, including a high temperature, a new continuous cough, or a loss or change in sense of smell or taste, should continue to follow government guidelines and self-isolate and book a test, or call 119 for England and Wales. If you have an urgent media inquiry, or you or your nursery is approached by a member of the media, please contact the Department of Health and Social Care Press Office in the first instance. We will now move on, next slide please. We will now move on and answer some of the frequently asked questions that you've been helpfully sending in. So first of all, you've asked how staff are defined in nurseries. So the nursery workforce and everybody that we're sending home test kits for includes all staff who are working in these settings. So it includes contractors and peripatetic staff such as clinical practitioners or therapists. You should also offer testing to other staff members all support staff, caterers, volunteers, etc. Some staff, particularly those employed through the NHS, may have separate arrangements for regular testing, which is absolutely fine, but it's about knowing that they are eligible via your nursery and making that offer to them. Another question that we've had through is, when should school and nursery staff do the testing? So staff should take the test twice weekly at home, 3 to 4 days apart. Even if staff work part-time or have irregular attendance, they should still take the test twice weekly. Peripatetic staff should choose one school or nursery from where they will collect their home test kits. Ideally, the twice weekly testing should be done in the morning. If, however, staff cannot take the test in the morning and it's more convenient for them to do so, they should take it as closely as possible to when they're coming into work. So, for example, staff can test on the evening before they're due to come into work. I'm just going to hand over the next set of questions that we've had through back to Peter Marks. Thank you.
Thank you, May. So a lot of you have been asking about whether people who have been vaccinated should still take an LFD test. The answer to that is broadly yes. At the moment, we don't know whether vaccines prevent individuals transmitting the virus or not. If staff have been vaccinated, they should continue to follow the steps set out in this guidance. There is no evidence that the vaccine interferes with either the lateral flow tests or with PCR tests. And a number of you have been asking about whether they should still take part in asymptomatic testing if they've recently tested positive for COVID-19. So if staff have had a positive PCR test for COVID-19 in the previous 90 days, they're likely to have developed some immunity. So individuals are exempt from testing by both PCR and lateral flow devices within 90 days of a positive PCR test, unless they develop new symptoms. However, individuals may choose to take a lateral flow test after the isolation period, for example, as part of a workplace or community testing programme. This should only be done after completion of the required self-isolation period, as per the NHS stay-at-home guidance. If you test positive with a lateral flow test, you will still then be required to self-isolate for 10 days. And you're still required to self-isolate if you're identified as a close contact of a positive case, even if that's within that 90-day window. Do I need to take a confirmatory PCR test if my LFD test is positive? So in line with the clinical advice, confirmatory PCR testing will remain in place for staff who test at home. Robust evaluations from Public Health England and the University of Oxford show that LFD tests are accurate, they're reliable, and they successfully identify those with COVID-19 who could pass on the virus without realising it. The tests have extremely low rates of false positives. LFD tests taken on test sites, such as school grounds, do not need a confirmatory PCR test at present. This is because these tests are done in a controlled environment and trained staff read the results. All positive results from rapid tests undertaken at home do need to be confirmed with a standard PCR test. This is because these tests are not conducted in a controlled environment and will not have trained staff on hand. Following a positive LFD test at home, a confirmatory PCR test should be booked online or by calling 119. Whilst awaiting the PCR result, the staff member and their close contacts should self-isolate. If the PCR test is negative, it overrides the self-test LFD test at home only, and staff can return to their settings. We've had quite a number of questions about what the ingredients of the LFD test kits are. So the Innova test kit swabs are latex free. The extraction solution components do not have any hazard labels associated with them, and the manufacturer states that there are no hazards anticipated if individuals follow the instructions for use. Any spillages should be wiped with a paper towel, and if the solution included the throat and nose sample, the area should be appropriately disinfected using household disinfectant. All of the antibodies in the test are necessarily generated from animal cells. While we do not test any of these products on animals, nor are animals harmed in the development process, the antibodies used in the test reaction are derived using an animal cell culture in the laboratory. The T line for a positive test is derived by reaction between the sample as it flows to the membrane, the thin paper-like material inside the device, which is coated with these antibodies. It's therefore highly unlikely that there will be any direct contact between the person being tested and any animal material itself. However, we want to make sure that the people undertaking the test make an informed choice about this. No animal products have been used in the production of the swabs. The swab is the only material with which the individual will come into direct contact. The individual using the test will not come into direct contact with any materials made from animal products. This is in common with other tests of this kind, including commercially available pregnancy tests. And one final question that's cropped up quite a number of times is the lateral flow device test safe for those that are pregnant? And the answer is absolutely yes. The tests are safe to use by those who are pregnant, and we are not currently aware of any sort of medical conditions that would contraindicate the use of the test kits. So back to you, May.
Thanks very much, Peter. So that's it from us for today. It's just left for us to say thank you very much for joining this webinar, and we hope you found it useful.
Yep, thank you very much for joining us today.
Goodbye.
Goodbye.